Hello, my name is Dr. Philip McCarthy. I'm a consultant cardiologist. I am the Clinical Director for Cardiovascular Services at King's College Hospital in London, and I also work from the London Bridge Hospital and the Bupa Cromwell Hospital in London. I have a large general cardiology practice, and so I cover all aspects of cardiology, investigating all forms of cardiac disease. But I specialise in interventional cardiology. And interventional cardiology is the change of structure of the heart, and it broadly involves either working within the coronaries or working within the heart to repair damaged valves or repair holes in the heart. So, the first part of cardiac intervention is coronary intervention, and coronary intervention involves altering the coronary arteries and treating narrowings in the coronary arteries. Now, we get to the coronary arteries by doing a cardiac catheter test. And the cardiac catheter test traditionally is done via the femoral artery in the groin. But over the last 10 years or so, we've been starting to access the coronary arteries via the radial artery in the wrist. And this is much more comfortable for the patient, it's safer, and it's better. And I specialise in radial coronary angiography and also radial angioplasty. So not only can you take the pictures of the coronary arteries from the wrist, you can also do your angioplasty and stenting procedure from the wrist as well. Angiography can be done in the stable setting when patients have angina, that is narrowings in their heart arteries that lead to decreased blood supply to the heart muscle. But it can also be done in the unstable setting, such as patients who are suffering with unstable angina or indeed heart attacks. And we treat a lot of patients at King's College Hospital who are actually having heart attacks. And London Ambulance Service bring them directly to us. We put a tube into their radial artery, we do the angiogram, we see where the blocked artery is, and we open it up with a stent. So that is coronary intervention. The next aspect to cardiac intervention, the work that I do as an interventional cardiologist, is structural intervention. That is, altering the structure within the heart of the valves and also closing off abnormal holes in the heart. Valvular intervention, that is, treating valvular heart disease minimally invasively, is a really big growth area. And we were the first people in the UK at King's to replace the aortic valve in a minimally invasive way from the leg. This was performed in 2007, and we are now one of the highest volume centres in Europe. This is a technique called transcatheter aortic valve implantation, or TAVI, and it is growing massively around the world. We've now done over 200 TAVI procedures, and I've done more than that because I've taught 11 centres within the UK how to do it. The other aspect of cardiac intervention is the closure of abnormal holes in the heart. If someone has a hole between the collecting chambers of their heart, that's called an ASD, and it can be closed by a little umbrella type device, which is quite easy to put in from the groin, and again that avoids the need for open heart surgery. The other hole in the heart that needs to be closed sometimes is called a PFO. That's a patent foramen ovale, and that is sometimes a cause of a stroke in a young person, where an abnormal blood clot can cross from the right to the left side of the heart. And we close PFOs again with a little double umbrella device, and it's a straightforward technique that is performed safely via the vein in the groin. So if any member of Invictus Health is suffering from any of the cardiac conditions that I've touched upon today, I would be happy to see them, investigate them and treat them accordingly.